You are most welcome, ladies and gentlemen, to the Understanding Spirit of Anatomy on Tuesday Night Anatomy with Daniel Okwan. My friends, today's meeting marks the final video as far as Tuesday Night Anatomy with Daniel Okwan year 2023 is concerned. My friends, going forward, I want to ensure that your anatomy becomes very easy, very interesting, loving all the time. And so for those of you who have not subscribed to this channel, my friends, I want to encourage you to do so. And also don't forget to turn on the notification, bell, so that whenever I drop any latest video, of course, you'll be among the first group of people to receive it. My friends, today's meeting is going to be a pretty simple topic, a short topic which I've treated the real impartation movement section about 2 weeks ago by way of the embryonic development of the tongue. So that glossal organ, that is what we want to review some questions on. So I have some few questions in a very rapid section. We are going to finish these ones, So my friends, without much ado, let's set the ball rolling. Now, if you look at question number 1, the first question says, the tongue develops from which bronchial arch or from which bronchial arches? Yeah, so I want you to answer it wherever you are. Try and see if you can get the answer. I'm sure you answered that it will be coming from, of course, the first bronchial arch, the third bronchial arch, and then, of course, the fourth bronchial arch. Something you can also call pharyngeal arches. So these are just 3. Now, last 2 weeks, when I taught you this, I told you that there are some authors or there are some individuals who may want to include second pharyngeal arch. No, that's not part of it. No. The reason is that it doesn't contribute, because I told you that it will be overgrowth of the third pharyngeal arch over that of the second, so that the second has no role to play as far as development of the tongue is concerned. So that's the answer. Now, if you go to question number 2, it says, what is the origin of the anterior to terse portion of the tongue? Yes, what's your answer? Yes, everyone knows that it's going to be, of course, the first pharyngeal arch. But precisely what structures are arising from this first pharyngeal arch contributing to this anterior to terse portion of the tongue? So which portions are they? My friends, there are 2 structures that I want you to know, and that is simply, of course, the lateral lingual swellings, the bilateral lingual swellings, and of course, the tuberculum impar. So your answer should be the lateral lingual swellings, and then, of course, tuberculum impar. Yes, that single malar, although it doesn't contribute significantly, but although largely the lateral lingual swellings are doing that, but also this median lingual bud also contributes. So whenever you are asked to tell the structures that give rise to the anterior to terse portion of the tongue, you don't forget tuberculum impar after you put down the lateral lingual swellings. Now, moving on, 10th question says, we should discriminate between the general and special sensations. Yes, by way of the nerve supply, to the 3 parts of the tongue. Now, normally, we talk about the tongue grossly differentiated into what we call the anterior to terse portion of the tongue and then posterior 1/3 portion of the tongue. Now, last 2 weeks, I made it known to you that we also have the posterior most portion of the tongue. So they are the 3 parts of the tongue I'm talking about. So I want you to tell me what will be the nerve supply by way of the general sensation and special sensation. Remember that whenever we talk about special sensation, I'm talking about taste. The tongue is mainly going to help in that kind of gustatory function, helping us to taste the chemical or whatever in anything. Okay, so then how about the general sensation we are talking about? Pain, temperature, touch, pressure, proprioception. Okay, these are the things we are talking about. Okay, so now let's see. By way of general sensation, so we think about it, and this one will also help us. That because the first pharyngeal arch, now remember, what is the post-traumatic nerve of the first pharyngeal arch? What's your answer? Your answer is, of course, the lingual nerve, a branch, okay, of what we call the mandibular nerve. Actually, from the posterior division of the mandibular nerve. Okay, that is the lingual nerve. So that lingual nerve, okay, becomes the nerve supply, carrying general sensation from the anterior to tertius portion of the tongue. Lingual nerve. So by way of the anterior to tertius portion of the tongue, I want you to put down over there, by way of the anterior to tertius portion, the general sensation is nothing but, of course, the lingual nerve. Okay, anterior to tertius, the general is by way of lingual nerve. A lingual nerve is coming from the posterior division of the mandibular nerve, and the mandibular nerve is one of the three divisions, the third division of the trigeminal nerve, the fifth cranial nerve. That's why we write V3, okay? V3, lingual nerve. Now, how about the spatial sensation by way of taste carried from this anterior to tertius portion of the tongue? I am pretty sure that you know that the first pharyngeal arch doesn't have only a post-traumatic nerve, but it also has a pre-traumatic nerve. Yes. And what is that pre-traumatic nerve? It is that nerve which is giving, okay, that branch in, of course, the middle ear. And that is why that nerve is called the chorda tympani. But remember, that chorda tympani is actually a branch of the facial nerve. But it becomes a pre-traumatic nerve going to carry special sensation by way of taste from the anterior to tertius portion of the tongue. So by way of special sensation, which I'll write S for special sensation, your answer is supposed to be chorda tympani. And chorda is a chord, yes, chord by way of the nerve. Tympani, okay, in the middle ear. Now, how about the posterior one-third? Yes. So for the posterior one-third, what's your answer? Now, that one becomes pretty simple because we know that this posterior one-third portion of the tongue, including the posterior most of the tongue, will be arising from what we call the copula. Copula, remember? And that copula is also called the hypobranchial eminence. These things we've talked about them, yes. So that hypobranchial eminence is arising from, of course, the third and fourth, arches. Now I'm talking about the cranial portion. So the cranial portion will give rise to the posterior one-third portion of the tongue. Okay, and that cranial portion is, is coming from where? The third brachial arch. And that is why the posterior one-third portion of the tongue will be supplied by nerve to, of course, the third brachial arch. And what's that nerve? So we have only post-traumatic nerve, okay, supplying the third brachial arch. And who is that nerve? Yes, I want you to put the answer down. My friends, your answer is, of course, the facial nerve. Facial nerve. Facial nerve. Sorry, we are not talking about second pharyngeal arch is facial nerve, but we are talking about third pharyngeal arch. So third pharyngeal arch is what? Yes, is the ninth cranial nerve. And what's the ninth cranial nerve? The glossopharyngeal nerve. And so, very easy for us. What is going to happen is that it is going to be for both general and special. Carry both general and special. Glossopharyngeal nerve. It's as easy as that. Okay? And whenever I talk about glossopharyngeal nerve, I'm talking about the ninth cranial nerve. Now, how about the posterior most portion of the tongue? The caudal portion of the copula. Caudal portion of course, the hypobranchial eminence. Who is that? Your answer, so the fourth. So who is that fourth? Superior laryngeal nerve. And superior laryngeal nerve is a nerve of what? Yes, we are talking about, of course, the vagus nerve. It's a branch of this vagus nerve we are talking about. But precisely, okay, if you are talking about carrying sensation, you are talking about sensation. So you are going to talk about the internal laryngeal nerve, okay, where is a branch of course, the superior laryngeal nerve of the vagus nerve, okay? So that's what we are going to see. So simply posterior most. Yes, vagus nerve. Let me make it vagus. But precisely, I'm talking about the internal laryngeal nerve or branch of course, the superior laryngeal nerve. Okay, that's very easy for us. Now, so we are done with question number 3. Now, how about question number 4? Now, before I go on and tell you these things, look at something. Now, we are in the region of the oral cavity. These are the teeth, okay, the lip over here. So from anterior, I go posterior. There's the superior portion, because I can see the palate over here, and of course the tongue in the floor of the mouth. Now, what we will see is that this is the tongue. So we have this as the anterior to terse portion of the tongue. From this extent, from the tip of the tongue all the way to this area, which I told you that area, okay, is that region where we have, of course, the sulcus terminalis. Sulcus terminalis, terminal sulcus, which represents that region where the cranial portion, okay, of the diverticulum of the thyroid gland, okay, migrated all the way from here towards the anterior portion of the neck. So sulcus terminalis. Sorry, foramen cecum. That's what I'm talking about. Foramen cecum, okay, representing the cranial portion of the thyroid diverticulum when it regresses. But on either side, that V-shaped region, okay, so when I go this way, there's a V-shaped, okay, region on either side, and that is something we call sulcus terminalis. So the midpoint of the two sulci terminalis, okay, will give us this foramen cecum. And then when I go behind the sulcus terminalis and foramen cecum, I get the posterior 1/3 portion of the tongue. And of course, this region, okay, where we have some folds, because this is the epiglottis. Remember that the epiglottis will also arise from the caudal portion of the copula. Okay, that is why the epiglottis, okay, this area will also be getting supply from, of course, the superior laryngeal nerve we are talking about. Yes, a branch of the vagus nerve. So this region becomes the posterior most, where we have the vallecula, okay, and connecting this, this posterior, 1/3 portion of the tongue to, of course, the epiglottis, okay, will be what you call the median and lateral glossoepiglottic folds, and the depressions over there will be, of course, the valleculae, okay, left and right valleculae will be there. So that is what we are trying to talk about over here. Now, the next question says, when a patient protrudes, now whenever we talk about protrusion, okay, protraction of the tongue, that's what we are talking about. When a patient protrudes the tongue, it deviates to the right side. Which nerve is damaged? Now, please, my friends, listen to this. Very important. Now, I told you that the tongue is a highly muscular organ. Yes, a musculoglandular organ. I'm talking about skeletal muscles, okay, running in different planes. Now, this tongue, we have two groups of muscles over there. We have the intrinsic muscles of the tongue. Those ones, they help you to change the shape of the tongue. So that the tongue can sometimes be very slender, sometimes it can be bulky. Okay, that's changing the shape of the tongue. Like we have the vertical muscles, we have the transversely running muscles, superior longitudinal, inferior longitudinal, even may have oblique muscles and what have you, different planes. They are within the substance of the tongue itself. Then we also have those ones which will have attachments apart from the tongue on another structure, like the hyoid bone, like the stylo process, like the palate. Okay, these are the things I'm talking about. So they become extrinsic muscles of the tongue. Those extrinsic muscles of the tongue, they help change the position of the tongue. So protruding the tongue from the oral cavity, depressing it and what have you, that means you have changed the position of the tongue. Now, one way, remember that I told you that these muscles, okay, they will originate from what you call the, occipital somites. Okay, the myoblasts over there, they will migrate and then come, of course, into the floor of the mouth, giving rise to these muscles of the tongue. Yes. So then the question is, these muscles, okay, they have a nerve supply, and the nerve supply is of course what? All of them. The 12th cranial nerve. And what is the 12th cranial nerve? It's of course the hypoglossal nerve. But there's an exception to this, and that exception was who? The palatoglossus muscle, because the palatoglossus muscle will not be supplied by the glossal nerve, the 12th cranial. No, it will rather be supplied by of course the vago-accessory complex, cranial accessory nerve via vagus. Although there are so many misconceptions nowadays, okay, sometimes even in some authors' recent publication or the recent edition coming from the Gray's Anatomy, I think the 42nd edition, is telling us that we don't even have cranial accessory nerve. We don't have that one. Yes, for that reason, we rather include glossopharyngeal nerve, okay, and superior cervical ganglion contributing to the cervical plexus, including of course this vagus nerve we are talking about, that by way of the superior laryngeal nerve. But let's not go so much into that. What I'm trying to say is that the exception, which you can say is supplied by pharyngeal plexus, is of course the palatoglossus. All the other muscles, intrinsic, extrinsic, are supplied by of course the hypoglossal nerve. And whenever we talk about hypoglossal nerve, we are talking about the 12th cranial nerve. So if you protrude your tongue and then it deviates, this time he said it deviated to the right side, which means that the muscles at the left side, okay, they are intact, they are working. But this one, because the nerve supply to the muscle is weak, that is why the muscle is deviating towards that side. So for the muscles, whenever hypoglossal nerve is involved, is injured, it will lead to ipsilateral, the same side deviation of the tongue. So for instance, because the tongue deviated towards the right side, then which nerve, by way of, is it right or left, hypoglossal nerve is injured? Your answer is going to be the right one. If it had deviated towards the left, it will be the left hypoglossal nerve. So in this case, I'm talking about the left hypoglossal nerve. Yes, that's what we are talking about. Okay, now remember, all these muscles we are talking about, let me show you some of them. Now, talking about the protrusion of the tongue. Now, there's a muscle over here. It takes, attachment on this bone, superior genial tubercle of the mental spine. Now, this muscle is the one which helps you to protrude your tongue. We call it genioglossus, so that you don't swallow your own tongue. Yes, you don't deglute your own tongue. What's the reason? Thankfully, we have this muscle, the genioglossus, and that is why we call this muscle the safety muscle of the tongue. It's also going to get a nerve supply from this glossal nerve. Yes. Yes, we have other muscles also. Now, this one over here, okay, we have glossus from stylo process to the tongue, styloglossus, okay, cannot be shown over here. Now, we also have hyoglossus, okay, so from the hyoid bone, okay, so this is the hyoid bone, okay, I have this as the hyoid bone all the way to the tongue, okay, hyoglossus, not really shown clearly over here, okay, and then we also have what we call palatoglossus. The palatoglossus, the one where is deep to this fold, palatoglossal fold, okay, deep to this fold. This is the one I'm talking about. Now, this palatoglossal fold, deep to it, when I remove this fold, deep to it, the muscle is over there, supplied by the pharyngeal plexus. And then I am also talking about, styloglossus. Okay, so styloglossus, palatoglossus, hyoglossus, and of course genioglossus. So it's the genioglossus that we are testing for it. Okay, deviating towards the other side. Good. Now, finally, the fifth question said we should mention 3 congenital anomalies, okay, actually tell the development of the tongue. And I believe you can tell me a lot. Okay, so if someone flicks the tongue out of the oral cavity and you see it to be bifid, that is something we call bifid tongue. Inability of the lateral lingual swellings to fuse completely, bifid tongue, just like the snake, that of the snake, bifid tongue or cleft tongue. That's one of the anomalies, cleft tongue. Cleft. Yes. Now sometimes too, the tongue may fail to form at all. Some people call aglossia. Aglossia. So it means that there's a problem with this pharyngeal arch things. Yes, aglossia. Not only that, it can be small, and that will be hypoglossia or microglossia. It can also be large. Macroglossia. Macro, yes. Don't forget, also I told you about one anomaly, and that anomaly is something which is worth knowing, because some people, they cannot, speaking, articulating clearly become difficult. Because the tongue, the ventral aspect, now after the tongue has formed, in the floor of the mouth, a lot of the tissues, need to undergo apoptosis, programmed cell, then you have to degrade all of them, leaving a midline, fold, join it to the floor of the mouth. And that is something we call lingual frenulum. Now abnormality of this lingual frenulum, may lead to something we call ankyloglossia, something we call, tongue tie. Ankyloglosia. Alright, now my friends, this is where I bring this meeting to a close. I want it to be a very short one to end the year. Now, God willing, the year 2023 will begin again, and I believe that it's going to be a good time, studying anatomy. I'm very grateful for your time this evening. I wish you Merry Christmas and a prosperous New Year.